In this video we'll briefly discuss what is carbamazepine and how it works, what it's used for, the dose and side effects, contraindications and precautions. Carbamazepine is an anticonvulsant and analgesic. It blocks sodium channels, thereby inhibiting the generation of repetitive action potentials in the epileptic focus, and preventing their spread. It is available as 200 mg tablets and 400 mg controlled-release tablets, and also available as 100 mg per 5 ml suspension. It is used in the management of tonic-clonic and mixed seizures, and complex partial seizures. The usual initial dose for adults and children older than 12 years, is 200 mg tablets twice a day, or 100 mg suspension 4 times a day. That can be increased weekly, by up to 200 mg per day, in 3 or 4 divided doses to reach the minimum effective dose. And the maximum dose for children from 12 to 15 years is 1 gram per day. And for patients older than 15 years is 1,200 mg per day. And the usual initial dose for children from 6 to 12 years, is 100 mg tablets twice a day, or 50 mg suspension 4 times a day. That can be increased weekly by 100 mg per day, in 3 or 4 divided doses to reach the minimum effective dose. And the maximum dose is 1 gram per day. Carbamazepine is also used in the management of pain and trigeminal neuralgia. And the usual initial dose in this case for adults is 100 mg tablets twice a day, or 50 mg suspension 4 times a day. That can be increased by up to 200 mg per day, in 3 or 4 divided doses until pain is relieved. And the maximum dose is 1,200 mg per day. Common side effects of carbamazepine include drowsiness and dizziness, ataxia, confusion, nausea and vomiting, rash, blurred vision and nystagmus. And it may rarely cause Stevens-Johnson syndrome, agranulocytosis, anemia, bone marrow depression, pancreatitis, hepatitis, and cardiac conduction defect. And in these cases treatment must be stopped. It is contraindicated in case of hypersensitivity to carbamazepine or tricyclic antidepressants, bone marrow depression, and in case of using MAO inhibitors within 14 days. And it should be administered with caution to patients with glaucoma, urinary retention, hepatic or renal impairment, heart failure or blood disorders, and to elderly patients. Avoid intake of alcoholic beverages, or other CNS depressants while using this medication. To minimize possible photosensitivity reaction, apply adequate sunscreen, and use proper covering when exposed to strong sunlight. Avoid driving and other activities requiring mental alertness, or that are potentially dangerous until response to medication is known. And notify your dentist or your treating physician prior to surgery if taking this medication. And finally, do not stop taking this drug without consulting your treating physician. That's all for this video. Subscribe and click on the bell icon for more animated medical videos like this one. And also check our recommended products in the description.